Now, non-communicable disease is a public health program across the globe, and in India, there's been a report published in ICMR, that's India State Level Disease Burden Report, which states that over a period of maybe 26 years, the non-communicable disease prevalence has actually increased. The mortality has increased from 33% in 1990 to it has increased to 62% in 2016. The purpose is to reduce the burden of non-communicable disease to 25% by 2030. So that has been our objective. When we speak of non-communicable disease, it encompasses various areas, like we have cardiovascular diseases, we do have chronic respiratory diseases, then there's cancer. But we have been addressing the most common one, that is hypertension, diabetes, breast cancer and oral cancer. The team, what they do is they go house to house, at village to village. They do the screening, they take blood pressure of all individuals more than 30 years, and they also do blood sugar testing. This is basically to identify hypertensive and diabetes. So there's a simple tool, we have devised to address to bring about behavior change for our communities with regards to non-communicable diseases. So that's as simple as A, B, C, D, E, F. So A is always ensure that your blood sugar, postprandial sugar, should be less than 180 mg per dl, and your HbA1c should be less than 7%. The purpose is he should not develop complications in the first place. Next is the blood pressure. They should keep their blood pressure under check. Blood pressure should be always 140 by 90 mmHg. 140 by 90 or less than that. C is for cancers. So there's cervical cancer, breast cancer, but then our focus is more on breast cancer. So cervical cancer, we inform that there are vaccines available to prevent cervical cancer. The vaccines can be given to girls as well as women. Girls, it starts from 9 years of age, and for women up to 45 years of age. For breast cancer, the breast self-examination, when we look at, it's a simple and an effective tool to detect breast cancer early. Now, as per NFHS data, breast self-examination is only 2%. That is, only 2% of women are aware about breast self-examination and are able to do it and identify are there any lumps in the breast. So diet, communities need to have, they need to follow a healthy diet, healthy oils. They should avoid vanaspati, ghee. For the salt, 1 teaspoon per day per individual is the ideal salt intake for an individual. So E is exercise. So exercise has to be built in, it should be a daily routine practice. They need to actually move, they need to walk. It's not like rural area, they will not have diabetes or hypertension problem, they will not have. So it is for all. Now if you are diabetic, you are hypertensive, you need to come for follow-ups. In the sense, you need to get your blood test checked to see whether your sugar is under control and whether your BP is under control, so that you can actually reduce the complications, or you can identify complications early.